It's such a moment in time with our beautiful daughters that we've been blessed with. They really are, the reason that I fight and work hard and do what I can. When we learned about the diagnosis, it's incredibly frightening. It made us even tighter and more appreciative of the relationship that we have, the five of us.
His diagnosis is a rare and complicated disease. We are incredibly grateful to have Siteman and WashU and BJC the whole time, and it has been a blessing for him.
Mr. Goedeke, actually, he's a patient of mine with a type of melanoma, is the most aggressive and the rarest melanoma, called the mucosal melanoma. So that arises from the lining of the mouth or any part of your gastrointestinal tract. So melanoma, most of it's from the skin. About 1 to 2% are mucosal.
People diagnosed with this 15, 20 years ago, it would be a death sentence. You didn't have appropriate options. Scott has been able to try several different treatment protocols, immunotherapy, and most recently was a TIL therapy, tumor infiltrating lymphocytes. They have been studying and trying to bring that to the market for patients for 30 to 40 years. It's saving people's lives. It's incredible technology, and it doesn't work for everybody.
Technology and the medicine really has advanced so much, even in a short period of time, even since I had my diagnosis. And I'm quite certain that if all that advancement hadn't happened in the last 10 years, I may have had the same outcome as what's in the literature about my condition, which is median 9 months survival. At the outset, Dr. Nassis was very reassuring and had a real confidence about his thought process. And every time we visited him from that point forward, it's always been evident, if not stated, that he's always had several things in mind that could be potential angles for me or the next step for me if needed. So I was one of the pilot patients to get TIL therapy at Siteman.
And we're able to get these patients enrolled in a clinical trial because we have not had any other option for these patients. So the treatment is being approved for patients who fail all standard of care treatment. So these patients have no other option, knowing that there might be still good hope about this therapy. So TIL, we know it does have about 30% chance to work on patients, while unfortunately the other 70% will not work. So what happened, your own immune system, especially the T cells, they do a killing effect. But sometimes they could be not fully energized, sometimes could be underpowered by number. There are only few ones. They do part of the job, but they cannot kill the whole tumor. TIL therapy actually came from that concept. So I would tell them, we need first to extract part of your tumor. We send that tumor to the company. The company will extract the residing T cells in the tumor. They just take them out, they populate them in a petri dish, and then we give it back to you in a piggyback, like blood transfusion, and see if these cells, when we empower them, they can do the job.
It's use your tumor to make your medicine. That's really like the bottom line. 6 weeks later, come back and get a scan. And they walked in the door, and I mean, he couldn't help but smile as soon as he walked in the door. And it was such an intense moment, really, because you just don't know what to anticipate. And his first words were, your scans looked great, you're a responder.
It's given him a lot of extra days with his disease here to be living his best life with his family, and that's really important to us.
If someone were to ask me, if someone were to get a diagnosis today and say, gosh, I'm overwhelmed, how should I think about this? And my advice would be that, you gotta fight, you gotta have, confidence, you gotta pray if that's what you do, but more than anything, don't believe that what's happened in the past necessarily will be what happens with you. Your outcomes could be better than anybody expected. That's possible with every single patient, I believe. I want people to really understand that things like clinical trials, things like, trying, unapproved medications for your condition, if there are no other choices, that's a positive thing, and that something good can come out of it.
We have a faith in God's plan.
For me, her support through all this has been just remarkable.
We value and prioritize time together, but we really value minutes together. They all matter.